All right. Well, thanks so much again for joining today. My name is Ken Fickler. I'm the founder and CEO of Gaize. Today's webinar is really intended to introduce you to impairment detection technology. So I'm going to go ahead and share my presentation and we'll get started. All right. So as you're probably aware, the problem that we're faced with today is that many states have started to legalize both cannabis and in some cases other drugs. And the presence of THC in the body does not necessarily mean that someone is experiencing active impairment. And so this really creates a confounding issue for workplaces and law enforcement as they try to understand whether or not someone is currently experiencing impairment from the drug or has just used it previously. And so the current situation and the solution that most businesses have adopted is reasonable suspicion trained supervisors and managers. And so this is special training that they can receive, which you're probably familiar with, and it's intended to allow them to understand whether or not someone could be experiencing signs of impairment. So you learn to recognize things like slurred speech and red, watery eyes, other things like that. And so that's really intended to, catch impairment as it is being experienced in the workplace. But as you might suspect, it's a pretty blunt instrument. It's not very precise. It's not an easy thing for a manager or supervisor to do. And the circumstances surrounding that can be really challenging, including accusations of being biased if someone is pulled off of a line and singled out. That's a really difficult situation for a supervisor to find themselves in, and can take morale hits as well. Most businesses today also utilize chemical drug testing. So that's, urinalysis, saliva, in some cases, hair and fingernail testing. And that's intended to, allow a business to discover if an employee is using an illegal drug. That's really a very limited utility in the case of cannabis and THC. Since it's legal in those places, users are allowed to have THC in their body, and they're not, necessarily committing a crime in that case. And we'll get to this in a little bit, but even the most sensitive THC tests are not necessarily going to tell you whether or not someone is currently experiencing impairment or has even used recently. So this is a really important and confounding issue. And simultaneously, of course, the world is legalizing THC. We currently have 41 states plus Washington, D.C. that have legalized. 24 of those have legalized recreational use. This map is current today, so you can look at your state and see where your standing is. I think what's really important to note is that only 4 states today still have completely illegal access to marijuana. And then we've got, of course, this year we're expecting to see potentially several states move into legal recreational access. And good examples of that, Florida, Pennsylvania, Hawaii are all potential states that could see access open up to them this year. And 30 countries have also legalized recreational cannabis, including notably Germany, which is likely to tip the European Union into a much more friendly legal status for cannabis in the coming years. Simultaneously, of course, with legalization, we've seen societal acceptance really increase for this drug. And, so that's increasing utilization of the substance, which of course increases your risk exposure in businesses. Some states are also starting to create laws that protect THC users as a legal, in a legal sense. And so good examples of those are Washington and California. Both of those recently created laws that do not allow a business to take adverse action against an employee or a candidate for a job based on the presence of a THC metabolite in their body. So that's a big departure from normal, where a business was allowed to simply test for THC metabolites and take adverse action. That's now no longer allowed. And we expect that trend to also sort of sweep the nation. And many other states are very likely to adopt laws in the coming years that will protect THC users as a class. And then, looking at other drugs, we've got, increasing rates of utilization for certain other substances, including ketamine, psilocybin, MDMA, and some other substances as well. And in places like Oregon and British Columbia, all drugs have been decriminalized. And so that's a huge departure from what we've seen historically. We'll see how those experiments turn out. I think that, Oregon is already starting to reconsider that. And so we'll see what happens there. But other, municipalities in particular are starting to look at certain other substances like psilocybin and decide that those should potentially be decriminalized. So a good example is Denver, which has, of course, decriminalized psilocybin and certain other psychedelics. This is some stats I pulled on the rates of substance use we're seeing today. So currently, about 56% of drivers that are involved in either serious injury or fatal crashes tested positive for at least one drug. And that includes alcohol, of course, but that's a really startling figure. And then in SAMHSA's annual drug utilization survey, 22% of Americans said that they'd used marijuana in the last year. And then during COVID, I think everyone probably knows someone during COVID that picked up using cannabis, and CDC was reporting 13% of Americans started a new substance use or abuse habit to cope with the emotional anxiety related to COVID. So we put this chart together. This is intended to communicate the length of time that you could be positive for each of these very common types of blood tests, or common types of drug tests for using marijuana. So what we're intending to show here really is that impairment detection technology is intended to detect impairment as it's being experienced. So that's acute impairment as it is being experienced. And yeah, I know that there's a lot of discussion about the length of the, impairment that can happen from using marijuana. And obviously, edible marijuana lasts much longer. So, take the impairment window there that you see at the top with a little bit of a grain of salt. There's a lot of caveats there related to the strength of the marijuana that is being used, the method of ingestion, the tolerance, how much is being used, all that. So with that caveat out of the way, what we're trying to communicate here is that impairment detection technology is looking for the signs of impairment that manifest in the body. And those can include a lot of different things, which we'll get into a little bit later. But really what they're intending to do is not look for the presence of a substance, but how the body is reacting to that substance. Moving on through the chart, we've got, breath. There's some two different companies are releasing breath testing technology for THC. The science is a little bit still out on that, whether or not that's going to be a good path forward. And the test that is available currently is not exactly what you'd be looking for from a THC breath test, in that you have to capture a sample, ship it off to a lab for analysis. And so it's not an instant read type of situation, but really that's the closest test that you can get right now to the window of impairment. So some companies are deciding that that's interesting to them. I'll also note that the breath test that's available today is only looking for delta-9 THC. And so again, perhaps limited utility there, but everyone should make their own decisions. The oral fluid tests are much broader, of course. You can test for a lot of drugs using oral fluid. There are studies that have shown really conclusively, and the manufacturers of the technology available today will tell you that you can be positive for THC for up to 48 hours on their testing technology. There's actually a study that has shown that THC can be in the saliva for up to 8 days since the last use. That is obviously an anomaly and way out of what we would expect, but that did happen. And so that's a big, I think, challenge in the supposition that these tests are recent use tests and therefore somehow related to impairment, which is just simply not true. Blood tests, you can be positive for about a week. Urine tests, we have heard from our drug testing companies that you're commonly going to be positive for about a month since you last used. 6 weeks is on the outside end of what you could expect, but it certainly happens. Hair tests up to 4 months, that's pretty routine. So this is a little quiz for everyone. I want you to think about which of these commonly used drugs is included in the standard 5-panel DOT test. And of course, this test is also utilized by a lot of other companies that are not DOT. And what I'm trying to communicate here is that there are a lot of drugs of abuse today, and not all of them are included on a standard either 5 or 12 panel test. But this is specifically the 5-panel. So I hope everyone has their guesses in. So these are the 5 drugs that are tested for on the DOT test. And obviously, when you look at this, there are some really big things that stand out. And so a couple that I'll point out are delta-8 THC even in states where cannabis is illegal, delta-8 THC is typically legal and easily available. You can, go to any gas station typically and find delta-8 THC. Um, Kratom is another one that falls into the sort of gas station availability category. That's a substance that acts on opioid receptors in the brain and produces sort of a similar effect. And then we've got, a bunch of other substances here. So that includes synthetic cannabinoids like K2 and spice, also, potentially available at corner stores. LSD and psilocybin, of course, are very commonly used psychedelics. Ketamine is a dissociative anesthetic that's actually legal to use in a clinical setting. And so that's something that we're seeing a lot of clinics pop up around the country that offer ketamine therapy. It's also used in certain other medical contexts, but it's becoming a pretty popular party drug. And so that's something that is not included. PCP analogs. So we haven't really seen pure PCP in the United States, according to the law enforcement officials that we work with, in a number of years. And instead, we're seeing these PCP analogs, which are not included on the standard 5-panel test, but are produce similar impairment to traditional PCP. Fentanyl, I think everyone is familiar with fentanyl. Of course, over 100,000 people died last year from overdosing on fentanyl, and it's an extremely challenging issue that our country is grappling with, not included on the standard test. Nitazines are an up-and-coming synthetic opioid and are even more potent potentially than fentanyl and not included on the standard tests. And then cathinones are a class of synthetic stimulants. And then benzodiazepines, very commonly prescribed, not included on the standard test. The thing I'll point out is that these all produce impairment that can be detected by impairment detection technology. And we are confident, specifically in our technology, we can detect impairment from each of these. So what is impairment detection technology? There are really two big categories of IDT. The first is performance-based, and that really is intended to measure how workers' cognitive and psychomotor performance is according to where it should be. And some examples of those tests include reaction time, balance, attention, memory, and decision-making tasks. And then there's physiological, and that's really intended to look for and measure physiological changes that happen in the body in response to drug impairment. And good examples of that are eye tracking tests, heart rate, pupil dilation, blood pressure, skin conductance, on and on. These are a couple examples of the types of IDT that are available today. So there's a category of app-based technology, and there are a couple different form factors that this can land in, but broadly, you're expected to complete tasks on an app, and then the app analyzes your performance relative to either your baseline or where it expects a sober person would be, and produces results relatively quickly based on what's happening. Most of the time, and in most impairment detection technology, they're looking for deviation from baseline. So that is, a baseline is established for each employee, and then their performance is measured against themselves over time. Gaize does not work that way. We don't require a baseline, but most other IDT does. And so the app-based technologies are relatively affordable, easily scalable. There's a lot of really interesting advantages here. Including, everyone's got a smartphone. And so that really simplifies, I think, the deployment for the app-based technologies. Our company, Gaize, as well as several other companies, are doing ocular analysis. And there's really compelling reasons to be using ocular analysis when you're considering whether or not impairment is being experienced. The eyes are, of course, directly linked to the brain, and law enforcement has understood for many years, for over 40 years, that certain changes in the eyes manifest in response to drugs. And so the companies that are doing ocular analysis are all sort of looking around and honing in on various indicators of impairment that happen in the eyes. That's typically, how open the eyes are, the way the pupil is responding, so that can be pupil size as well as the rate of change of the pupil size in response to varying levels of light. And then the way that the eyes are moving as well. So we call that gaze vector, and it is basically the direction in which the eyes are looking, the rapidity in which the eyes are able to move, how accurate they are in landing on certain targets, and things like that. And then the last category would be body movement analysis. And so there's certain indicators of impairment that can manifest in the body that cause things like body sway, sweating, other things like that. I know the least about this type, but it's out there. It's apparently being used today, but there's potentially, I think, some accuracy considerations to keep in mind for that one. So the legality is something that always comes up when we start introducing impairment detection technology. Today, there are no laws in the United States that preclude the use of impairment detection technology in any context in a workplace. So that's a really important thing to know and to understand. We always want to remember, though, that IDT is not a drug test. It's not looking for the presence of a substance in the body. It's not measuring a bodily fluid to understand what's inside of it. And so as a result, IDT does not fall within the kind of standard laws that you would consider for a drug test. There are real advantages to that because it can be used in contexts where drug tests cannot, including, like on-site testing or random surveillance screening. That's a really interesting opportunity for businesses, I think, to introduce new methods of keeping their workplace safe. There are some caveats to this. It's new technology. Most IDT has only been on the market for a year or a couple years. And so there has been no court utilization to date of IDT, of Gaize, certainly, and I couldn't find any other court cases that have utilized the IDT in them. I'll speak internally. Gaize is very prepared for the eventuality that we do go to court. Our tests are based on the drug recognition expert process, and so we've got a very long-standing history of use behind our tests. I can't speak for how prepared any of the other companies are, but I think we're all understanding that this is something that is coming, and we're certainly all trying to be as prepared as we possibly can for court. There is no government body or other regulatory body that provides approvals for IDT. And so, this is really creates an opportunity for companies to quickly enter the space, I'll say, but it also creates an opportunity for technology that is less proven to be on the market. And so I would really encourage everyone that's on here and listening to this to be very careful and look at the science behind the technology that you're choosing. That's a really, really important piece of this step, particularly in light of the fact that the government has chosen not to regulate this space yet. I expect that someday they will. At some point, the FDA will probably step in and say, hey, this is an area we want to regulate. That has not happened yet. And in lieu of that, it's really going to be up to the consumer of these technologies to make sure that they're getting technology that has a very high accuracy and history of use behind it, and then it's reliable and something you can trust. As I mentioned, no laws currently specifically allowing or disallowing IDT. I will note on this slide too, though, when we do see new laws being created, like the AB 2188 in California and the law in Washington that preclude the utilization of THC metabolite tests, all things are sort of moving in the direction of IDT becoming the standard for keeping workplace safe. We're obviously on the front end of that, and I think we'll see a lot more movement in the near future, but the science is certainly all pointing to impairment detection technology being the right tool to use to recognize impairment from substances like cannabis, and the laws are certainly moving in that direction as well. So we really think that impairment detection technology is the best fit solution to detect drug impairment. And as I mentioned, alcohol is kind of the only substance that works in the way that it does, in that you can measure the amount of alcohol in the body and derive how impaired someone could be from that number. Cannabis, other drugs do not work that way. And attempting to apply those sorts of rules to cannabis is a really bad idea. It just simply is not the right path forward. So certain impairment detection technologies have, tried to measure their accuracy against drug recognition expert police officers. There are these things called green labs that my company has been to and several other impairment detection technologies have been to. And what they do is they basically get people high on weed in a controlled setting so that law enforcement officers can learn to recognize the signs of impairment. It's kind of a good opportunity for them to all practice and learn what to look for when they encounter someone on the roadside. So the results of those are not typically published, but occasionally. And what you want to look for is an impairment detection technology that has gone through that sort of rigorous training with police officers and has demonstrated really good accuracy against what what they've found. It's typically very easy to use technology too. I'll say that, one of the questions we often get is, okay, let's say I'm interested in getting this for my company. How difficult is this going to be to integrate and train on? And the answer is typically that it's really not that bad. I, again, can't speak to any specifics with the other companies, but we're pretty friendly in this industry together. And so, I think most people have used each other's technology, and it is really a pretty simple thing to train people to learn and deploy into an organization. Most IDT is also portable. And so this is a really interesting thing. So whereas you cannot probably have every truck driver on the road using a drug test and then reporting those results back, you can certainly do that with IDT. So for example, every truck driver on the road could be utilizing something like Gaize or one of the other solutions, doing a test, and that test gets pushed up to a server where, any suspected impairment would be found and that driver could be removed from the road. So the portability is a really interesting and important thing, and it's a total game changer when you have spread out site locations or are needing to test in remote places where you may not have access to easy drug tests. It's also, I'll say, less invasive. Non-invasive is a big term, but certainly less invasive than all the other, existing drug tests. We're not capturing bodily fluids, so we have none of the, privacy concerns that come with, then having possession of someone's DNA. That of course, needs to be treated very, very carefully. Most IDT is not capturing biometric information either. Again, speaking specifically, we've passed every biometric review that we've ever gone through. We're not capturing any personally identifiable information, and so it's very sort of non-threatening, or a lot less threatening to employees than, hey, go pee in this cup and we're going to watch you do it, and then we're going to check it for substances. That's a really bad experience for most people, and IDT can be a pretty nice change from that. And then lastly, instant results. This is such a big deal. When companies go through drug testing, often they're faced with, waiting days or even a week to get results. And that's, of course, extremely challenging when you've got someone that's been removed from the job site. Now you're paying them to sit at home and wait for their drug testing results. It's a really, really bad situation, and it gets very expensive for companies. You're now paying for someone to be removed from the site, driven to a drug testing location, waiting around for those results, and potentially dealing with, a lot of other, lab fees and things like that. Whereas impairment detection technology can typically give you a result instantaneously, and so within just a couple of minutes what's going on with an employee, and you can make the right decision from there. We're going to get into science for a second here, but the speed of testing, as I mentioned, is really important. Our technology takes about 6 minutes to get results. Some others, are higher or lower, but it's all kind of in that same range where, again, it's not just the capturing of the getting results that is much faster, but the testing process is faster too. And of course, it's data rich as well. So, rather than having someone show up and you're hoping that the chain of custody gets right, you've got a lot of metadata that gets captured in the process of doing an impairment detection technology test. So I'm going to transition here to talking a little bit more specifically about our technology, which is Gaize. And I'm happy to get into this in much greater detail with any of you if you'd like, but this is the platform that we have built. And so what our technology does is it performs a series of ocular tests that look for signs of impairment. As I mentioned, we're utilizing the drug recognition expert eye tests. So these are tests that have been utilized by law enforcement for about 45 years, and they are well known and well trusted. They've been through court in all 50 states. So we think that gives us a real advantage in terms of the probability of court acceptance and having our technology withstand the scrutiny that a court would bring. So the headset you see on there on the right side is where all the tests get performed. So you put that on a test subject's head, and that provides really an ideal environment for us to perform these tests because we can precisely control the amount of light entering the eye, and we can precisely do the tests exactly according to how we want them done. They are exactly repeatable, and you can really remove human error from that process. In the middle here, you see our mobile app that pairs to the VR headset and allows the test administrator to start a test as well as to receive test results. And then on the left side, you see our web app that allows someone that's, like an HR manager, for example, to oversee what's happening on an account, look across site locations and see where tests are being performed. It's a really nice platform and a way for people to understand what's happening on an account level. We have been through 2 clinical trials so far, one still in process. Our cannabis trial was the first that we did. It ended up being the world's largest. We had no intention of that being the case, but we did some statistical analysis to understand how much data we needed, and we ended up needing 350 participants, which turned out to be the world's largest. So that was a happy accident. The test protocol basically for that was we brought people in a theoretically sober state. We found some that were not so sober when we started testing them. So did a sober test, and then we got them high using recreationally available cannabis and tested them 4 additional times at specific time stops. And the intent here was really to understand both how they change from their sober state as well as what does their high look like over time. So we can really start to understand where someone is in that high and whether or not, they're how impaired are they, and is that going to be increasing or decreasing? We ended up with an extremely large amount of data as a result of that, which we used to validate our models at detecting cannabis impairment. And that kind of our white paper preprint on that was recently published in a small medical society journal. So I'm happy to forward that to anyone that's interested. Our academic paper is still in the review process, which is a very protracted thing. We have also recently embarked on an alcohol study. And so our intent here is to validate that our technology works for detecting alcohol impairment. We're about halfway through that. We'll be wrapping that up this month, and I'm very excited to be publishing on that soon. And we've got several other clinical studies that are in various stages of the planning and approval process. And so that includes a study on fatigue. We're really excited to get some fatigue data and start integrating that into our technology so that we can both recognize fatigue and differentiate that from drug impairment. We're also going to be studying common psychotropic prescription drugs. We're going to do a study on cannabis tolerance, combinations of drugs. So for example, cannabis plus alcohol, which can produce pretty distinct effects and different from using one of those in isolation. And then stimulants and opiates, both common substance classes that we run into. This is an example of one of the 6 tests that we conduct. What my intent here is to help you understand the kind of data that we're looking at and the kind of indicators of impairment that manifest. And so in the left-hand chart, which is a sober chart, we're looking at the peaks and valleys, which are relatively smooth on the sober chart. And then on the impaired chart on the right, we can see a pretty characteristic waveform, and that's called nystagmus. And that's a characteristic bouncing motion that the eyes make. It's typically present in alcohol and other depressant drugs. And so this is, again, just a really easy one, I think, to understand what you're looking at. For every test that we conduct, we look at over 120,000 data points. So it's an extremely large amount of data that we analyze for every test. And today, we are confident that Gaize is effective at detecting impairment from illegal opioids, including heroin and fentanyl, alcohol, prescription opioids, smoked and edible THC, psilocybin, potentially other psychedelic drugs, and then stimulants. Gaize is in use today in a lot of businesses across the United States, from those that are, sort of small companies with, maybe less than 100 employees, all the way up to the Fortune 500. Our pricing model is based on getting a unit deployed into an organization. And then at that point, we don't nickel and dime you for anything else. So that includes unlimited tests, unlimited users, free training program, US-based customer support, instant results, all the data access to everything that we capture in the test. We think we want to incentivize people to use the product, not disincentivize them by charging you per test fees. So what does the future of impairment detection technology look like? What we think is that it's very likely to become the standard front of line testing technology for businesses and law enforcement. And obviously that's going to take time. It's going to take some time for us to disintermediate the existing drug tests, to validate that our technology is as accurate or more accurate, and then to have businesses adopt that. We're in the process of doing that today, of course, and a lot of the impairment detection technology out there is actively working towards that goal. We're very much looking forward to completing all these clinical trials that I've talked about, and I know that other clinical trials are in process for other impairment detection technologies out there as well. I'm really a proponent of all impairment detection technology. If Gaize is the right fit for you, wonderful. We'd love to work together. If it's not, that's fine too. But I would really encourage you to take a look at what the other offerings are, and think about whether or not this could be a good fit for your organization, because it really seems to be a much more fair and accurate way to be detecting impairment in a workplace. And then lastly, I'll say that we're honing in on new and novel indicators of impairment. So this extends much beyond, what has been traditionally known to science, and that's a really exciting place to be. We're excited to be publishing soon on some new indicators of impairment that we think we've found, and we believe that this is going to continue. There's not a lot of science that's been done on how drugs impact the body. It's been a very difficult thing to study historically, and it remains somewhat difficult today. But we're really excited to continue advancing the state of the art forward on this. So thank you so much for the time today. I think I've left a little bit of time for questions. Yeah, we got definitely some time for questions. So feel free to drop those into the Q&A section on this, and we'll switch back over to Zoom here. All right. No questions so far. I hope that means I did a really great job. You could also feel free to raise your hand if you'd like, and I can call on you and allow you to talk. All right, we got a couple questions coming in. If Gaize does not need a baseline, what comparison or information is the test using? So what we're looking for in the test that we conduct is the indicators of impairment that law enforcement have been looking for about 45 years. And so nystagmus is a good example of that for alcohol. There are certain other tests we perform for other drugs. And the answer here is that, these are known indicators, and so they've been well understood for a long time. And so our algorithms can detect those indicators. And basically what we do is report that to the end user. Is Gaize used standalone? The answer to that is no, not at this time. Our customers typically utilize Gaize as the first line of defense, and then we'll follow any presumptive positive impairment reading with a drug test to validate that there's an impairing substance present. What I'll note on this too is that we can direct the customer based on the tests that are passed and failed into which category of substance is likely causing that impairment. And that's a really powerful thing, because as I noted earlier, drugs like fentanyl are not included in a standard drug test. But when we can say, okay, this person is likely experiencing opioid impairment, well, then you can do an opioid panel and really start to understand in a much deeper way what someone could be impaired on. It can also sometimes be used, vice versa. We've got third-party administrators, for example, drug testing services companies that use Gaize after they get a positive drug test. So they'll go do a drug test. If they get a positive, then they do a Gaize test to understand whether or not someone is actively impaired or previously used. A link to the white paper that was published. Yes, absolutely. I will I'll try to drop that in chat, actually. Yeah, let me try to, I'll either drop it in chat here if I have a second, or I'll email it to everyone. Academic publication available with a link. Yes, I will get that out. Does Gaize replace drug tests? The answer to that is no. We are a supplement to drug tests, and the intent here is to capture as much evidence as you can as to what's going on with an employee, and not necessarily to rely on just a drug test, which is only telling you about prior use, or just impairment detection technology, which is telling you about what's currently going on. You really want to capture as much evidence in the course of that as possible, in order to give you as much certainty as you can on the next steps that your company is going to be taking. Share some use cases on how our customers are using Gaize. Yeah, definitely. So typically Gaize is utilized in either a reasonable suspicion or post-incident setting. And that can be, a really great way to use the product, where you've got somebody who does a minor safety incident, for example, and then you can use Gaize to understand whether or not they're currently experiencing impairment, or if they just made an accident. That's the way that most of our customers are using it today. What I think is really interesting and exciting about impairment detection technology, though, is that it opens up the door for more proactive methodologies to keep a workplace safe. And that might include surveillance screening prior to the start of shift or after a lunch break. For example, you can say, well, we're going to have 5% of our shift to go through a test every single day. And that'll really, have a massive deterrent effect on using cannabis or other substances in the workplace. What is the cost? The cost today, so April 2024, starts at $7,500 per unit. We can do some work on that price based on volume and length of contract. So, we're happy to discuss that. Typically, organizations are deploying Gaize in each of the locations that they have, and maybe 1 to 2 units per location. It's kind of depending on how they want to use it. Obviously, you want to do something like a surveillance screening of your employees. Then you're going to need to understand how many employees you want to test each day, and then how long you want to spend testing. And that'll, that simple math equation will help you understand how many units you need. Any annual or monthly fee for support? No. It's an all-in-one price. So as of now, we wanted to keep it very, very simple. We don't want to be nickel and diming our customers. We want people to get our product and get using it, and not have any penalty for using it, or any limitations on how it gets used. All right, any other questions? All right. Are we exposed to HIPAA? No. So Gaize was designed from the ground up to be to not capture any personally identifiable information and not capture any biometric information. So that last one usually surprises people, but we do not capture anything that can be resolved to an individual in the course of our process. And that was all done very intentionally. We have passed legal review with some very large organizations, and so we're very confident in that at this point. And then on the biometric front, we've gone through, again, legal review on BIPA, which is the Biometric Information Privacy Act that Illinois has. That's the strongest biometric law in the country at this point, and we passed that one. So we do not capture anything, again, that can be resolved back to an individual in the case where our data was leaked or hacked or something like that. Standard trial phase length. I assume that is for a new customer that wants to trial the product. And in that case, I would say, why don't you reach out to us and discuss? We don't typically do, free trials or something like that, but I'm happy to discuss that use case if you'd like. Okay, anything else? Well, great. Thank you all so much. Really appreciate you attending. I will get this recording out to you all shortly, and please be in touch if you have any questions. I think you probably saw my email at the end there, but again, it's ken@gaize.ai. And I will follow with that published clinical trial data as soon as we're done here. Thank you so much. Have a great day.